all over the universe, not just in India, in United States, where I lived in England for 20 years. A thin cornea is a no-no for LASIK, PRK, SMILE or any kind of laser technique that would reduce the thickness of the cornea. LASIK has become a household word today. And I was very fortunate and I'm grateful, and believe me, I repeat, it's grace of God. And I was right time at the right place. In 1995, I was the first person to introduce LASIK in England. So then, after 20 years of my stay in England, I came back in 1996 to India and introduced the first LASIK here. But technology is constantly evolving. I wanted to explain to you what is LASIK, what's it all about, how much you guys understand what LASIK is all about. This is how I tell my patients that when you look at your eyes, there is a dark part and a white part. In the dark part of the eye, there is a transparent watch glass-like structure called the cornea. This whole laser is done in this transparent watch glass-like structure, the cornea. To explain further this transparent glass-like structure, the cornea I was speaking about, where the laser is done, if you look at this, you can see the central transparent cornea. And also you see the blue color here from behind. So we have dark eyes and white people have blue eyes. Now, if I showed you this cornea from the side, what we do is we send a laser beam right to the central 5 millimeters and remove very precisely layer by layer, meaning we are thinning the central part of this cornea. By thinning, the shape of the cornea from steep, it becomes flat. This change in the shape of the central cornea is the correction. It is so simple. Whatever you do, whether you do PRK, LASIK, SMILE, Silk, Contura, Zyoptics, whatever technique you do, the purpose is to change the shape of this cornea and give you the vision that you would see with glasses. No more and no less. So now that I told you basically it is thinning of the cornea, this is where when I started in the year 1991, we never had any instrument or any device to check the thickness of this central cornea. Because if you know the thickness, then you can carefully remove within the limits so that no damage comes to this cornea. So what happened was technology evolved. So we got devices now to measure the central thickness of the cornea. And today we have a fantastic scanning systems like this. And they're also called OpScan, and this one is called a Pentacam. Now this gives you very accurate, not only the central thickness, a lot of information about this cornea. Now that information is given in numbers for us, the doctors, to interpret. And also is color coded for patient to understand that red is danger, green is safe. So that is what these scans will tell you. You are suitable only for a lens rather than a laser, because your cornea is too thin. So you're safer both in short term and long term to have a lens placed in your eye. Now I'm not talking about a contact lens that you put in the morning and take it out in the evening. I'm talking about a kind of permanent contact lens. A permanent lens that can be injected into the eye and it stays there forever. And it is like LASIK. When people look at you, they can't tell that you had anything done. And it is like LASIK. It gives you that vision that you are seeing with glasses. So don't believe supervision and all. There's no such thing. Nobody gets more vision than what they see with glasses, whatever technique they talk about. Because this treatment is for life. And I'll tell you what happens, supposing when you are removing the layers in the cornea, it is in microns. If you should understand a micron, it's about 10 to 15 times thinner than single hair. So when such a delicate operation is involved, what happens if you take away too many layers? the cornea will become weak. If it becomes weak, immediately after the operation for 2-3 years, you may be okay. But slowly and gradually, the power, all the power that was removed will come back. Not only the power this time, at least power comes back, you can wear glasses. But this time it's going to give you distortion. Distortion is like images you see in a circus in the mirror where you see all wonky pictures. We can't live like that. So prevention is better than cure. LASIK is done around 20 years of age. So up to 40, you are going to be absolutely free of glasses, but in and around 40 you get presbyopia, meaning age-related reading glasses, which is a plus power, mind you. Now this will start in and around 40 and you will start wearing reading glasses. Even then you will be seeing the distance without glasses because you already had LASIK, PRK, SMILE, ICL, whatever, refractive surgery done. But today we have remedies even for that. So when people do reach 40, there are techniques that can be done. Lastly, ladies and gentlemen, it's very important for all you guys to understand whether you're a young doctor who is going to get into refractive surgery or a patient who is planning to get these techniques done, a thin cornea is a no-no for LASIK, PRK, SMILE or any kind of laser technique that would reduce the thickness of the cornea. This is for young doctors also to understand that their lives are in our hands and your decision making is very, very important. Thank you.